And you were right. Good afternoon, everyone. Another Facebook Live with me, Tanya Grantham. And today I'm really, really excited to be interviewing Catherine Brown, a animal behaviorist. And part of my reason for this is not just because Catherine does great work and I'm fortunate enough to be treating her dog, but because I feel that we should be focusing more on the animal health team. And I've already done a Facebook Live 20 minutes on who I perceive to be the team. So a behaviorist is definitely a member of the team. And I think that's often one which is perhaps not recognized. And also maybe there are members of the public that aren't even aware that such a profession exists. So today I would like to welcome Catherine. Hi, Catherine. Thanks for taking the time to join us.
Thank you so much, Tanya. It's very exciting to be here. It's kind of scary, kind of nerve-wracking. Although, as you can see, I've got my social support animal, Ellen, who's here to help me. But yeah, I totally agree with you that every animal needs a support team of various professionals. And I personally think, of course, that a behaviorist is an extremely vital part of that team. Because you're looking at behavioral welfare, which means emotional welfare. So that's going to come into every aspect of an animal's life. So yeah, I would wholeheartedly agree with you.
Oh, perfect. And I mean, you say emotional welfare, like that's top of your, of your concerns. And we have already looked a lot in our Facebook Live talks at animal emotions. I certainly don't disregard them. I think they're vitally important. When I qualified, I think people believed that animals didn't have emotions. And so, we've come a long way in recognizing that they do, and then looking to how do we create environments which benefit the animal. So let's start with some questions and then we'll see what comes in from the public. I would just like to say from the start, please, this is not for personal advice with regards to your animals. Catherine is able to be consulted on an individual basis, and this is not the scope for those questions. So we're really looking at it as a profession and trying to understand more of what's available and more of what a veterinary animal or an animal behaviorist can actually do for you and for your companion. So, I mean, how did you enter into the realm of animal behavior?
Yeah, well, it's not exactly, well, it maybe is a bit more now, but at the time when I started, it wasn't the kind of profession or career or something where you could take a traditional route, where the route was sort of laid out before you, like it would be, say, for if you were going to become a vet or if you were going to become a psychologist, either one of those. So a lot of people entered the dog behavior world via dog training. And I'm one of the people who didn't do that. I came into dog behavior via human psychology. In that I studied human psychology. I wanted to be a human psychologist. And I did my honors degree at the University of Johannesburg, which I thoroughly enjoyed. And then I decided, I had a lovely lecturer at UJ who encouraged an interest in me in animal assisted therapy and the massive benefit that animals have to humans. And in order to do that, you have to study whatever animals you may be utilizing as part of that therapy. So I had a year in to do something while waiting to apply for my psychology masters, which in theory I was going to do. And in that year, I found Ethology Academy. I did their 2 dog courses, their 2 cat courses, and their animal assisted therapy course all in one year. I thought, right, let's get all of this done. And I then only very half-heartedly reapplied for that master's because I realized I discovered something that I had a much greater passion for, and still combined all the things that I was interested in, because I wanted to help people, I wanted to help animals, I wanted psychology involved, I wanted those three things. So I felt like, oh, I'm still doing essentially the same thing. I'm just approaching it from the animal's perspective, rather than the humans. But that's essentially how I got to where I am now, is that I wanted to do animal assisted therapy, and in studying animal behavior, discovered that actually, no, that's sort of where I belong a lot more.
Well, I mean, that's fascinating. That's really interesting that you took a different route. And also, I'm interested now in how much. So when I spend a lot of time with my clients, as you know, and I believe that that space allows for a lot of frank discussion, and it allows for a lot of exchange of ideas and that sort of thing. So I would imagine, does your position now also involve human psychology?
Well,
I
I've
mean, we're
often
digressing now, but
no, no,
I
no,
just,
that's
it's like,
fine, no problem. No, that's a really interesting question, but and you're right. I've often said that my qualifications or skills with human psychology are often a lot more useful than anything I know about dogs or cats, because ultimately I'm working with the people.
Yep.
I'm not working with the animal. They're working with the animal, and it's my job to teach them how to do that effectively. But ultimately, I don't live with my clients. I don't live with their animals. I'm not going to be engaging with them all day. So they have to learn what to do, and it's my job to teach them. So
Okay.
yes, very much I work with people. I work with my clients, and I take that relationship very, very seriously. It's very important,
Yeah.
because you're to be going through trials with each other, good times, bad times, hard times. So yeah, that relationship is very, very important.
Yeah. Okay. So can you tell us, what does it exactly mean to be an animal behaviorist?
It's such a hard question, because it really, really is. It, I've been thinking about this since you asked me to do this interview. Is what do I actually do? But no, it's they. Okay, so what is an animal behaviorist? So okay, they are a professional who, of course, is going to come in and assess your animal's behavior. Now, that sounds very, very simple. We come in, we look at the output, and we see, right, how can we manipulate things to make that output, behavioral output, better? Okay, that's putting it very, very simply. What we actually do is collect a massive amount of information. Okay, we need a lot of information first, because behavior is a tiny little tip of a massive iceberg. And underneath that behavior is genetics, and that's a massive thing, okay, just by itself.
Yeah.
Is early developmental experiences, is social experiences with people, with other animals, is training. What kind of training has this animal had? What kind of interactions have they had? What is their diet? What is their environment like? What are the stresses in that environment? What do they enjoy? What's their personality? What do they like? What do they dislike? And we look at all of these things, and we look at, right, what might be affecting the behavior of concern? Okay, and then we look at which of those things can we tweak and change, and which can't we change. So now genetics, it's not a whole lot I can do about genetics. And I'm afraid that's where, a lot of people, there's a myth. A lot of people think it's all in how you raise them, and it's not. That's a myth. We cannot easily mess with genetics. Okay, there's some places we can't go. And personality as well. To
Yeah.
an extent, you cannot manipulate personality. as much as you as much as you might like it, if your dog has a certain, predilection for lying on the couch and exposing their bits to every single visitor that comes in, if that's in their personality, I'm sorry, I can manipulate the environment, things like that, but I can't change that tendency. Okay, whatever your tendency might be, whatever, well, I say your tendency, the animal tendency might be. Okay, so yeah, so there's certain things we can't change. We look at the things we can change. Can we alter the environment? And that's a lovely one. I love it when we can alter behavior by altering the environment. And that's very often just, for example, let me give you the most obvious example. My dog runs out the gate. Put up fence.
Yes.
That is one of, if you can solve behavioral issues with managing the environment, that's fantastic. That's really fantastic. It's nice and easy. It's nice and safe. It's nice and secure. That kind of stuff's brilliant. But yeah, then we can also look at things like basic needs: food, water, sleeping areas, play, social interactions. Are all of these basic needs being cared for in a species appropriate way, in an individual animal appropriate way? And then, yeah, ultimately, then we start looking for training. What skills can we teach this animal? How is this animal communicated with? How do the people communicate with this animal? How do they teach this animal? And is it in ways that are conducive to learning the appropriate skills? Or is it done in such a way that actually is possibly potentially harmful, damaging? Yeah. So it's complicated stuff.
Yeah.
It really is. Behavior is complicated. Changing behavior is complicated. It's not just sort of quick little magic trick fixes. It's not the TV dream. It really isn't. It's sustained, consistent effort from owners to get sustained behavioral change.
Yeah, and I mean, I really like that sustained, consistent effort to get sustained behavioral change, because very often, I mean, we do as vets, for those of you that don't know, I mean, we do an element of animal behavior. We must do. And we are then able to prescribe drugs which can change behavior. But I am often asked by a client, oh, my dog likes to do this. Why? My dog likes to jump up on people. Why? and as you've just explained, it's so complex, and there's so many factors. And little Joey down there is completely different to Sasha at the other, in the next suburb. So it's not as simple as people think. And I also, for those of you that have consulted with me, will know that if there is a way in which I can find a more natural solution as opposed to a medicine solution, then I'm going to want to try that. And maybe we can explore a little now, maybe, and say, I mean, are you in a position to use medication? Do you work with vets that you ask to supply the prescriptive drugs? I mean, where are your limits, and how frequently do you think they're necessary?
Okay, so you ask great questions. Okay, so meds they play a very important role, very important role for a lot of behaviorists, because a lot of the time, as you say, a lot of the time they almost considered a last resort. Whereas with some dogs, when it comes to behavioral stuff, sometimes they're the first step, especially if, for example, you've got a dog, say, when you're dealing with extreme anxiety, then very often, especially in those sorts of cases, medication first, because we have to get the animal into a state where they can think and learn, where they're receptive. Exactly, that's perfect word. Whereas if they're all big mess of anxiety or fear or anger or sadness, or whatever it might be, whatever is going a bit haywire, especially if it's extreme, and sort of normal measures are unlikely to have a quick enough effect. Sometimes we want meds and we want them straight away. And
Yeah.
in some cases, yes, it might mean, obviously, again, every case is unique. Every case is individual. So yes, there are some cases where perhaps it may be necessary for a dog to be on medication for maybe their whole life.
Mm.
So I've had cases of dogs like that. Say um, dogs that have noise phobias, or separation anxiety, or anxiety related aggression issues. Those dogs, some of them, yes, they'll stay on medication forever. But what we do is we just try and get it to the lowest possible point. Okay. And those are the more extreme cases. A lot of dogs, it's just a short-term thing so that they're in that receptive state. They're in that learning state. We can teach them new skills and then slowly sort of wean that down. But medication does play a very, very important role. And a lot of it gets a bit of a bad rap, because a lot of people are scared. Oh, I'm going to have a drowsy dog. I'm going to have a sedated dog, or it's going to change their personality, or things like that. Those are a lot of common fears, and they're very understandable. But most of the time, what we, of course, depending on the medications you're using, most of the time, you're going to have exactly the same animal, but just an animal coping a heck of a lot better.
Yeah.
And an animal that can learn. Yeah. So yes, no, absolutely, plays a big role. And working with vets then is very, very important. Very important,
Yeah.
because I cannot prescribe all, certain medications. I cannot prescribe an SSRI or a benzodiazepine or something like that. What I can recommend and do when necessary would be nutraceuticals. Yeah, nutraceuticals. So the amino acid, tryptophan-based
Mm.
supplements, things like that. Also, fantastic options.
Yeah.
Pheromone products as well. I can recommend those. But yeah, when it comes to the meds, very much I like to work with a vet, ideally a vet who knows the animal well, and knows their medical history and stuff like that.
Yeah, so I mean that's really great. So for those of you, who maybe missed the very beginning of the talk, it's really also about this for me is about the animal health team. And right now we're coming into, Catherine, in order to be able to get the results that she wants, she needs to consult with the vet that actually looks after. So the primary healthcare practitioner, or the general practitioner of that specific animal, because they understand the family, they understand the dynamic that is occurring within that household. So let me also just be clear when I say I'm reluctant to use medicines. It's not that I won't use them, and I don't want there to be a misunderstanding. I find that very often the use of medicines is seen as a quick fix.
Yes.
And it is not a quick fix under any circumstances. If you have an animal, be it a cat or a bird or a dog or a horse or a sheep or in anything that has a behavioral problem, a drug is not a quick fix.
Oh no, not at
But
all.
it can
Not at all.
facilitate the learning. And it's really interesting for me because as we start to understand more about the ways in which animals learn and the ways in which things influence them, we are talking about things like skills, and we are talking
Yes.
about confidence, and we are talking about resilience. So all of those things that we are looking at now, I mean, very relevant in the pandemic. How resilient are we to stress? How resilient
Yes.
are we to being alone and not having contact with our own species? Depending on the species on which you're working, those factors are also going to be really relevant and important for you as a behaviorist.
Oh no,
So
absolutely.
yeah,
Absolutely. Yeah, no, and you're absolutely right about medication and being a quick fix. It's not. It's not. You do medication without behavior mods, it's not going to work as well. Yeah.
Yeah. And I mean, do you work with all species? I've called you an animal
Okay.
behaviorist.
Now, I'm accredited with the Animal Behavior Consultants of South Africa to work with dogs. I also work with cats. I studied both. I still study both. And then, of course, the human animal as well is, of course, part of the
very
picture.
well qualified.
Yeah. So, but yeah, I specialize in dogs and cats specifically. Yeah. I
Okay.
wouldn't, I don't ask me for advice on horses or birds or fish. Dogs and cats are my go-to.
Okay, but there is training and there are courses available for those other species. You know, when I've looked at it, I've
Yes.
specifically looked at dogs, so I've specifically looked at cats because that's my area of interest.
Mm.
But as an animal behaviorist, you're not restricted to that.
No, no, no. It's so nice these days. There are so many, there's just so many more opportunities to learn about lots of different species and their behavior, and as you say, how they learn. Um, and it's becoming a lot more just about training animals. It's like what you were saying just now about the words we use. We
Mm,
are talking more about not just, oh, has your dog been trained, is what skills does your dog
mm,
have?
mm,
Um, and the way we're talking about all these things is changing very, very nicely. But yeah, there are lot more courses and a lot more information um, available to people these days about animal behavior. Yeah, you
mm.
can go down so many different pathways that it's almost a little bit dangerous. This is why I haven't quite finished my studies yet, is because there are so many other beautiful, shiny courses all over the place, and lovely information everywhere, that it's very, very easy to get distracted by it all.
Yeah. Well, from my experience, my learning is never done. I mean,
No.
I'm constantly learning and also always being attracted to, different things as I develop. Um,
Yeah.
so I mean, I can't believe how quickly the time has gone. I would
Oh,
like to
wow. Yeah.
ask you,
Mm.
very often, so I just want to concentrate a little bit on the behavioral conditions, and then we've got some questions if that's okay. Um,
Sure.
but very often, what I've seen is that a, a physiological issue. So, in other words, a disease state. So, physiology is something that's occurring in the body, is often misunderstood or misconstrued as a behavioral problem. And
Mm.
in this instance, I'm specifically thinking of pain that could cause aggression. How many other, can we explore a little bit that idea so that people don't
Yeah.
necessarily assume the dog is aggressive? And also, what other conditions do you treat?
Okay. All right. So yeah, the link between pain and aggression is a really nice example of how physiology and the state of health of an animal affects their behavior. And it's a nice example because it's so easy for us to understand. I
Mm,
think we've all at some stage in our lives been either in discomfort or pain, and you've been bothered, or someone's touched you in that spot or something, and you've lashed out. It's very easy to understand that sort of defensive and um, almost vulnerable sort of state. But again, tip of the iceberg,
mm,
because like, let's just look at pain by itself. Pain by itself isn't necessarily going to cause aggression.
mm,
It could be related to anxiety. It could be related to hyperactivity. It could be related to depression. It could, this is the
yeah,
problem. Well, not really the
yeah,
problem, but it's something important for people to understand, is that I don't separate um, physical and mental health or
yeah.
emotional health. They're not separate things.
Mm,
They are very, very closely interlinked. And and again, this is where we get to the complexity of behavior, in that the physiological states of the animal is just going to be part of the picture of that behavior. Um, but yeah, just looking at purely the physiological side of things. So yes, pain is a very common cause of issues. It's to the extent, if you look at some of there's some lovely research that came out by Daniel Mills. When was it? I think it was last year, the year before. Um, Looking at the extent of physiological problems and yeah, specifically pain in behavioral issues, and it is, don't quote me on this, I'll find a link to the study and I can put it in the comments. But the finding of that study was basically that something up to 80% of behavioral cases could have an underlying physiological component,
mm,
which makes perfect sense. It makes perfect sense. If you're not
Yeah.
feeling 100%, like if this is not functioning, the organism is not functioning at 100%, that output, that behavioral output, is going to be a little bit off. So yeah, it's not just things like pain. We'll also be looking, of course, things like hormonal imbalances, conditions such as Cushing's, Addison's, thyroid conditions.
Yeah.
Those things, those are some nasty little buggers. They really are. And they can be difficult to spot even with testing. So those are quite yeah, so that's a physiological thing that can easily come into play. Just trying to think off the top of my head. Yes, sensory issues. So if a dog is experiencing problems with their sight, with their hearing, problem. This is something that you will be able to identify with a lot. Dogs that are having problems with movement, ease of movement, agility. How fit is that dog? How strong is that dog?
Yeah.
How comfortable is that dog? All of these things absolutely are going to play a huge role. So in an ideal world, before a dog or a cat, I'm going to include cats with this, because cat behavior issues are also very, very commonly misdiagnosed. Cats having litter box issues, how often
Pain.
It's arthritis.
My hips
it's arthritis.
don't work.
My hips don't work, or something like that. So it's all animals. And so in an ideal world, any animal that's going to come and see me has gone to see a vet first. And in that ideal world, they've had a full diagnostic workup.
Yeah.
Including MRI. That's say in an ideal world, to make sure that there isn't something weird going on. When I've been working with someone for a while, sometimes we'll say, it's time for that vet check now, because we're not getting anywhere, and we find, there was a cracked tooth, there was an underlying a low-grade infection, etc., etc., etc. So our physiology, and as I said, physiology and behavior, emotional and mental health, you can't separate. You really can't.
Yeah. Great. I mean, that was a great answer. And I think you can also see where I'm heading in terms of the animal health team. We have different skill sets. You and I have different skill sets, but they are required to give us a very good, healthy companion.
Yes, absolutely.
So I'm getting like red flagged here with regards to time. So I'm going to go over. I mean, it's cool. For me, fascinating. So Siobhan from Husky Rescue says they've used your services, and it's the people who need the training, and there's been a lot of agreement there. And when Siobhan, just with regards to your genetics can't be tampered with, training a husky to recall when there's a cat around is not possible. Okay. And then there's
but depends on the individual. Keep in mind, depends on the individual. There's that one husky, that one outlier.
Yeah. Well, that's true for everything. And then there's a question about what role does diet play in behavior?
Oh, wow. How many days have you got? Briefly, big role. What you want, that old saying, you are what you eat.
Yeah.
It's very, very true. Okay. So remember that behavior, think of it as, if you're thinking of it as, this is just a very easy way to think of behavior, as an output of this organism. If this organism is healthy, the healthier this organism is, the better that output. So if you can find the diet that suits your individual animal and it's as high quality as possible, sometimes just doing that can have a massive influence on behavior. Sometimes just changing the diet. Same as us. If you're eating things that are maybe irritating your bowels, let's say you constantly got a slight discomfort in your intestines, that's going to affect your behavior all the time. And then some magical human changes your diet to something that's more appropriate. Oh, I feel great all the time. You're going to have a calmer, happier dog. Already behavior's better. So short answer, yes.
Okay, so I hope that I mean, we could do another talk on that.
Wow.
Mignon says
easily.
Yeah. Mignon says she did the basic and advanced animal behavior course at Ethology Academy, as well as a puppy training course a few years ago, but she hasn't had the confidence to consult with people and their dogs. How can she gain experience?
How can she gain experience? Wow, that's a really, really difficult question to answer. But the thing to do actually is to speak to the accredited behaviorists and to speak to organizations like the Animal Behavior Consultants of South Africa, or to speak to the tutors and the people who run courses like the orthology, the COPE courses, the pet sense courses. Speak to the people who run those courses. And what would be ideal is to find a mentor, is to find a behaviorist who will let you shadow on some of their cases, whether that's virtual consults or in-person consults, or training consults at a training ground, whatever form that consult takes. If you can get a mentor, more than one, actually, ideally, mentor with as many people, as different people as possible, that would be the ideal. Because going straight into consults, once you finish diving straight into consults, once you finish your studies, I would say it's not ideal, because, without some sort of mentorship first, I did that many, many, many moons ago. It was 11 years ago when I started. I went a little bit too much like diving headfirst into consults without some sort of supervision. And it's not ideal. You really, if you can have that sort of experienced supervision, will make a big difference, because it's not always the easiest job. You're not always dealing with easy topics with people, and things like that. So if you can have someone experienced to hold your hand a little bit at first, that is fantastic.
Yeah, great. Thank you. So Janke is saying one of the biggest challenges of the pet training behavior world is that it's not a registered industry, and anyone can claim to be a trainer, which is true. And there is a drive, as there has been a drive for the Veterinary Council to register veterinary physiotherapists as a profession. There is a drive for the Veterinary Council to recognize veterinary behavioral therapy and to set that up as a separate profession. But currently, you're correct, there is not one. Or there is not a recognized profession. And so people can do a weekend course and claim to be a behaviorist. So my suggestion would be to look for, because there's another question about how do we know whether the puppy school trainer behaviorist is competent? My suggestion would be to look for, COPE is very well respected and well understood. And I sent them to my whoever's manning Facebook, Danico, and maybe you can just put it in the chat. And if you don't, I'll put it in. COPE, COAPE. And then ABC is the Animal Behaviorist Consultancy. All of those people that belong to those organizations have done serious training. They remain registered. I'm not sure whether you have to continue to up your game. Is there anyone else, Catherine?
Okay, so this is, you've entered now, this is the minefield that is the behavior and training world. And it's a shocking free-for-all. Sometimes literally shocking if you look at some of the tools that get used. But it's an international problem. Because as you say, you don't even need that weekend course. You really don't. You can just right now say, I'm a dog trainer, I'm a behavior consultant, I'm going to go into people's homes and train their dogs, do something with them.
And yank dogs around because I can.
And yank dogs around until they do something vaguely, towards what we want. So yeah, it's a bit of a free-for-all. And what that means is that unfortunately the public does have to be very, very careful. There are general guidelines, and again, I can post this. There are a couple of very nice articles online that tell you what to look for in your trainer, what questions to ask. So the kind of questions you want to look for is, what are the consequences? This is the most important question, probably. What are the consequences if my dog gets it wrong? The answer you want is nothing. There is no consequence. That's the answer you really want. What you're looking for is trainers and behaviorists who are going to put, as I say, that are mental and emotional welfare first. If that's not coming first, run a mile, basically. But yeah, will, as I say, there's some nice articles that do lay out the kind of questions you can ask your potential behaviorist or trainer before you use their services.
Great. And I think if you could put that up there and it's available, freely available, it's a good reference point
Very good.
for the members of the public. So we've got one last question.
Okay.
Which I think is a good one. So Sonia wants to know, can fear or anxiety be hereditary? Or is it simply a loss of early or no socialization, or a combination?
Okay. Right. So, no one wants to see that. Okay. So, fear and anxiety. The answer is yes, 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 and yes, and yes. So, can it be hereditary? Can there be a genetic component? Yes. Can it be because of a lack of early experience? Yes. Can it be because of bad early experience? Yes. Can it, you know what? It's fear and anxiety is one of the things everything will influence it. It will have, it can possibly have many, there can be many components. You know, fear especially is such an important survival tool that it pops out actually quite easily, unfortunately. But yeah, it will be affected by everything: environment, individual animal, individual resilience of that animal, how they recover from poor experiences. Are they helped to recover? Are they not? What are their basic needs attended to? Again, if you've got, let's say, for example, you've got a fearful, or not a fearful, necessarily a fearful dog, but let's say you have one dog who's living in the lap of luxury, best diet, best beds, they go to the park, they get played with, etc., etc. Then you've got another dog's no basic needs really addressed: poor quality diet, sleep outside in the cold, don't get interactive, etc., etc. And you give both of those dogs, you know, present them with something that is scary. You might just find that that dog that's having their basic needs well addressed copes a bit better. So that can have an effect. But again, it comes down to the individual dog. You might just find the complete opposite. So yeah, individual genetics, experience, everything comes down to the individual.
Yeah, no, I mean, it's fascinating. I could go on for a whole lot longer as I can feel so can you. But it's been a really good interview, and I do thank you so very much for your time and for sharing your expertise. And and how do you want people to be able to get hold of you for consultations? Can we put your information up?
Okay.
And,
so so one of the easiest ways to get hold of me is via my Facebook page, and I'm happy to put a link to that there, or to send me an email. People are welcome to get hold of me. If they need help, I'm also happy to refer them to, if I can't assist them, or if I think I'm not the best person to assist them, I'm happy to refer them to someone who I know is reputable. Or they're also welcome to, of course, go onto the ABC page and or the code page and look for someone there.
Cool. So that was a really important, I'm happy to refer you to someone who I think may be able to help you. So those are, you know, for me, when someone is willing to do that because maybe you don't have the skills, very well done.
Thank you.
So thank you everyone. And just in closing, Daniko says nice positive feedback from the viewers. So thanks so much, everyone.
Awesome.
We've come to the end of another Facebook Live. Catherine, thank you, thank you, thank you.
Thank you so much. Thank you.
We'll chat again soon.
Okay, cool. Awesome.
Good night. Love to your cat.
Good night.
She's settled finally.
Finally, of course, at the end.
Yep.
All right. Good night.
Great. Take care.
Bye.